Rolling stroke brushing technique. The rolling stroke is used to remove food debris and plaque from teeth and stimulate the gingival tissue. Procedure steps. Brush the teeth with the bristles pointed apically, upward for the maxillary arch and downward for the mandibular arch. Press the bristles against the gingiva firmly yet gently, then roll them slowly across the tissue and teeth, toward the biting surface. Press the bristles firmly yet softly on the gingiva, and roll them carefully across the tissue and teeth toward the biting surface. Repeat the 5 rolling strokes with the brush in a different location. To clean the lingual surfaces of anterior teeth, use the toothbrush's heel or toe. The bristles must still be rolled toward the biting surface and gently pressed into the region. Phones brushing technique. The phones technique is used as an initial brushing method to achieve good overall cleaning. Procedure steps. Close the jaws and place the brush against the cheek. Starting with the posterior teeth, the brush is placed over the maxillary and mandibular teeth. The brush proceeds over the teeth in a circular motion as it progresses toward the anterior teeth in a sweeping motion. The anterior teeth are placed in the biting position, and the brush is used in a circular motion sweeping from right to left. Tongue brushing. Bacteria can inhabit the top surface of the tongue. Therefore, a conventional toothbrush is most often used to ensure the cleaning of the tongue surface. To clean the tongue, the toothbrush should be placed as far back as is comfortable and then be drawn forward to the tip. Allow the bristles to clean the debris that has accumulated. Repeat this process until the entire tongue has been cleaned. Taking care of your toothbrush. The dos and don'ts of maintaining a toothbrush. Do not share toothbrushes. After brushing, rinse your toothbrush thoroughly with tap water to ensure the removal of toothpaste and debris. Allow the brush to air dry after using. Store the brush in an upright position. If multiple brushes are stored in the same holder, do not allow them to contact each other. Soaking toothbrushes in disinfecting solutions or mouthwash is not necessary. Using dishwashers, microwaves, and ultraviolet devices to disinfect toothbrushes is also unnecessary. These measures may instead damage the toothbrush. Do not cover toothbrushes or store them in a closed container. Replace your toothbrush every 3 to 4 months, or sooner if the bristles appear worn or splayed. Benefits of flossing. Dental flossing is the second essential element of a good oral hygiene program. Flossing should be done every day. Dental floss is the most effective way to remove bacterial plaque and other debris from the areas inaccessible to brush. Regular use of dental floss removes plaque and helps to prevent the buildup of plaque. Flossing your teeth can make them look brighter by removing plaque and excess food particles from the areas that your toothbrush doesn't reach. Plaque is made up of invisible masses of harmful germs that live in the mouth and stick to the teeth. Some types of plaque cause tooth decay, and other types cause gum diseases. How does flossing help your gums? Flossing daily, combined with brushing and a rinse, keeps your teeth and gums healthy. It helps you to get a good smile. Flossing removes plaque and food particle between your teeth and gum and helps to prevent gingivitis. If you don't have an oral care routine that includes flossing, you can get gum disease at a very early age. People suffering from sensitivity or gum bleeding may want to avoid flossing. But in fact, flossing can improve the health of your gums and prevent them from bleeding. In 51 sets of twins, researchers investigated the effects of brushing alone versus brushing and flossing on bleeding gums. The twins who flossed had 38% fewer bleeding gum regions after 2 weeks. How to floss? Of course, it isn't enough to just simply floss. It's important to floss correctly. Improper flossing can potentially damage your teeth and gums. Follow this step-by-step guide to floss your teeth correctly. Get 18 inches of your dental floss. Wrap the ends of the floss around the middle or ring finger as anchors. Grasp the floss between the thumb and index finger of each hand, allowing 1/2 to 1 inch to remain between the two hands. For the upper teeth, pass the floss over the two thumbs or a thumb and finger and direct the floss upward. For the lower teeth, pass the floss over the two index fingers and guide it downward. Direct the floss to pass gently between the teeth, using a sawing motion. Try to avoid snapping the floss through the contacts, because it may damage your gum. Curve the floss into a C shape to wrap it around the tooth and allow access to the tissues between your teeth. Move the floss gently up and down the surface of the tooth to remove the plaque. Lift slightly and wrap the floss in the opposite direction in a C shape over the adjacent tooth. Move the floss gently up and down the surface of this tooth before removing it from the area. Rotate the floss on the fingers to allow for a fresh section to be used each time, and continue to clean between every tooth. Use the dental floss around the distal surface of the most posterior tooth by wrapping it into a tight C shape and moving it gently up and down with firm pressure. Floss the most posterior teeth in all 4 quadrants in the same manner.